Hello, everybody, and welcome back to the Charity Charge Show. This is Grayson Harris, and today we are just absolutely pleased to be joined by Chris Knopf. He is the CEO of the Stevens Center. Chris, I really appreciate you coming on and sharing a little bit more about the work that you are doing with the Stevens Center and your local community with our audience.
Yeah, I thank you for the opportunity. The Stevens Center, located in Omaha, Nebraska. We are in our 41st year. We approach the issue of homelessness and tackling this issue with basically providing three services, three programs. We have a high barrier emergency shelter. I say high barrier because we are a shelter that works with all different shelters and helping people find a bed, find resources, find a path to housing. But for us, because we have families and children on campus, we have to maintain a safe, a sober campus. So, as a high barrier campus, in order to be eligible for one of our shelter beds, there is a drug testing, alcohol
Mhm.
screening component that happens. Certainly, once in the emergency shelter, we're able to provide those basic needs, but also connect people to case management. And what that means is, what I always talk about, our shelters are not a band-aid. When we talk about shelters, the true work happens with those case management assignments and those relationships and trusts that are built, breaking down or at least identifying those barriers between that individual and that family and a housing destination, understanding the list of available community resources we have to break those barriers down, and then placing individuals and families into a positive or permanent housing destination. This year already, we're about 82% of people who have entered the shelter are able, because of that help, exit to a positive or permanent housing destination. So that's something we're
Incredible.
very proud of. The other two programs, we have an addiction recovery program, a 64-bed residential addiction recovery center on site. So if your barrier is addiction, alcoholism, we can do the chemical dependency evaluation, see if you're a fit for a program, and get you right in there to start doing the work. Graduate from short-term residential to intensive outpatient, eventually outpatient, coming out as a clean, sober, essentially a new person, ready to charge into their new chapter of life. And then certainly nationwide, we talk a lot about affordable housing. I'd actually like that conversation to be more around low income housing because, quite frankly, there is a tremendous amount of people that are experiencing homelessness or about to experience homelessness that don't even meet those affordable housing thresholds. We need to be talking about creative ways towards low income housing with case management that allows people to, again, get the needs or get the resources needed to eventually move beyond the low income housing option into something else. So we have 64 permanent supportive housing units, but
Got
what
it.
they are is low income apartments that are supported with case management services.
Good. Thank you for setting the context in terms of that really important work that you're doing out there in Omaha, Nebraska. And the way you phrase it is that you are not a band aid solution, right? And
Correct.
something that may be a band aid solution that was proposed out there in Omaha, right? This
Right.
idea of that you've been fighting over these last 2 months is this idea of pretty much kind of almost banning or legalizing kind of homelessness. Can you tell me
Criminalizing.
criminalizing it. Can you tell me a little bit more about what that fight looked like and kind of really where you disagree with that?
Absolutely. So on or around August 26th of this year, one of our Omaha City Council members proposed an ordinance that at the time, if you were living in an encampment, if you were camping on public property or private property, whatever it might be, law enforcement could detain you and you would have one or two choices. You either go to a shelter or you go to jail. And if you go to jail, you could also be subject up to a $300 fine. The unfortunate reality of how this all came to be is that we had a situation where that council member could have reached out to the local agencies and talked about the realities of our environment, of our city. Had he done so, he would have realized, and maybe he didn't care, but I don't want to speak for him, but he would have realized, at least in that conversation, that there's not enough of an inventory of either high barrier shelter beds, low barrier shelter beds, none of it. So it's not a choice. When you don't have the shelter beds available, in part because of a lack of funding at that city level, then what you have is one choice. It's jail. And if you throw a $300 citation on top of that person, and they're already judgment proof. They've already probably are suffering from bad credit. They have trouble, their rental history might have evictions, and that might be negatively impacting them. And anytime you throw these punitive measures
Extra
on
barriers.
extra barriers, what you're doing is making it, and as a city, you're actually purposely making it harder for an individual to get to a spot of housing, of employment, of being a
Independence.
tax-paying member of society, of raising a family, being what we would otherwise kind of say a productive member of society. And it's just short-sighted. And when it becomes that short-sighted, you can't help but look at it as you're either cold, you're either just driven by political ambition, or you just don't care.
I really appreciate it, you sharing that story and this idea, right, that there is not enough beds within the system to support it, right? Tell me a little bit more about that need, and then also, we're on the onset, as we record tomorrow of these, the SNAP kind of aid kind of being cut. Explain a little bit more about what this looks like, what internal conversations are going around in the organization as you look to support, this increased demand, and also look to support this existing stuff that's already there too.
Right. So I'll just back up really quick
Of
about
course.
the city council endeavor. Fortunately, conversations were had with a number of city council members, and in an odd way, I will give some credit to the council member who brought this forward because, at the very least, it has spurred on a larger conversation and a more direct conversation between the agencies, the shelters, and city council members, and even the mayor himself. And I'll say the mayor has been just such a wonderful ally with us. I mean, he said from the get go, if this crosses his desk, he's going to veto it. But what it has done is it's created a larger conversation, and it has created us the time because it did get voted down by a 5-2 vote. That crossed party lines. So there were Republicans and Democrats joining in and saying this is not the best way to approach this solution. And as a result, we are working on a 6-month pilot program aimed at better response to encampments, better
Mm.
public response, but providing the necessary time to work with those individuals in those encampments to find a place to go, to find the resources that we need. Now, to your question in terms of how we've responded to that, we have found room in our budget to double the size of our street outreach team. And our
Wow.
street outreach those are the case managers that otherwise would be in the shelter, but they know where those that are unsheltered are.
They know the community.
They built the relationship, they built the trust. We are providing those essential shelter service. We're providing those housing plans with those individuals who are outside of our walls. So because of those relationships, because of the skills of our incredibly talented street outreach team and the talent of all the other agency street outreach teams, now when there is a notice of encampment posted, it's not just an immediate sweep. It's a 7 to 10 day process that allows our street outreach team to go in with the trust that they've built and start working in a more expedited way on finding an alternate housing solution or providing more resources for those individuals who are eventually going to be removed from that encampment.
Really appreciate it, and that really just speaks to that idea of this, collaboration and really the community aspect of the work that you're doing, right? And I love to re-highlight this aspect of this high barrier shelter that y'all provide, but then as you have this incredible street team, out there really connecting, they're also connecting these unhoused individuals than with these other kind of shelters, these low barrier ones as well, through these kind of partnerships and collaboration that you have, correct?
Absolutely. In fact, how I got my start in this space was working for a low barrier shelter here in town called the Siena Francis House, and it is a amazing organization. It's the state's largest emergency shelter, and it's a low barrier shelter. And what
Yeah,
that means is they don't serve families, they don't serve children, but they serve the need of those people that have high behavioral health issues that, in fairness to Siena Francis House, they have a tough time providing the necessary clinical resources in a city that has a shortage of behavioral health resources to serve those individuals. But oftentimes that's the population that goes there. Those that are under the influence of drugs or alcohol, that is a place where they can go and get a shelter bed
yeah,
without having to go through a screening process. Those individuals who might be at various stages of the criminal justice system and otherwise get screened out at other shelters, that's a place they can go. to contrast. And it is such an essential need to this community. And sometimes I feel bad because I feel like we have the benefit of saying, oh, we've got families and children, and it tugs on the heartstrings a little bit more. But the reality is, if we didn't have a low barrier shelter and a low barrier shelter the size of Siena Francis House, this whole thing would unwrap. And what Siena Francis House has compared to what we do is they've got basically two men's dorms that have 171 beds each. And then they've got a women's dorm of 94 beds, in addition to their own addiction recovery program, too, and
Of
permanent
course.
supportive
Yeah.
housing. Whereas we, as a high barrier shelter, and this probably just comes as a slow but growing evolution of the need to serve this space. We have 32 men's beds, 32 women's beds, and we've got 4 family rooms. That was part of my push when I assumed this role of, hey, if we can't serve people here, we've got to get out in the community. We've got to build a street outreach team and help this fight, help the other agencies, since we don't have the capacity and space to do it here. We're fortunate where we do have some funding, where next summer we'll be breaking ground on a brand new family shelter that will
How
actually allow us
exciting.
to, yeah, it's great because it's going to allow us to double our ability to serve men experiencing homelessness, women experiencing homelessness in that congregate manner, kind of that dorm setting. But we're also building an additional 19 family non-congregate shelter rooms, because what we do that is different is dad doesn't have to go to one area of the building, or mom doesn't. We keep the family unit together. And so there are extreme rises in families and children experiencing homelessness.
Yeah.
So we absolutely have to serve that. This will allow us to also do more permanent supportive housing, those low income units as well.
I really appreciate you sharing all this impact, right? And really where the community is stepping up and how it all kind of fits together. As our nonprofit audience kind of tunes in and they're looking to, they're seeing this, increased these cuts, right, to staff across the nation, and they look to their local community. What advice would you give to them as they look to foster the same sense of kind of collaborative support for their community?
The first thing I always say, and I don't know if it's the easiest thing or it's the most difficult thing, but clear your mind of stereotypes. Clear your mind of what you think a shelter is. Clear your mind of what you believe a individual experiencing homelessness is, and how he or she or they got there. Start thinking and start being open to the idea that a shelter isn't a band-aid. A shelter, and funding a shelter, is a small investment to real long-term change. That funding in a shelter is the path to housing, to jobs, to workforce, to community, to productive members of society. I would also ask people to clear their minds as to what they think homelessness is or looks like, and why people are in it. The reality is, and this is a number that has been shocking people, and this is a number that we just started tracking late last year and into this year. It's not a number that many agencies have tracked for whatever reason, but we've called it our turnaway number, because we hear the pit count, which is the annual
Yep.
point in time where people actually go out on the coldest night of the year to try to do a physical head count of people within their area to get a sense of what the numbers are. And that number is so small in comparison to what we are finding as one agency, a smaller agency, what our turnaway numbers are. And as a high barrier shelter, so far to date this year, we on 4,128 times, we have had to say no to a family, to a man, to a woman who is looking for a shelter bed, is looking for that change, is able to pass our screening, but we just don't have the space. We don't have the room. And those are individuals that many of them are not addicted. Many of them are not alcoholics. Many of them maybe
Yeah.
have some behavioral health challenges, but not to the degree that
Don't we
can't
all?
be assisted with services. These are individuals that their car broke down and they lost their job because they couldn't get to work. These are individuals that they themselves or their child had a medical situation and they can't pay that bill. These are people that the cost of living and the cost of housing has skyrocketed so much that even though they've been in their apartment for 10 years, now rent has gone up at a rate that far exceeds what their salary has, and they get evicted. These are
Hmm.
good people that want better for themselves, they want better for their children, they want better for their community, and they are just asking for some help. And again, going back to kind of the cold capitalist, if you will, it's such a smaller investment to make in helping the resources we have to get people there, than to criminalize, then to fine. And it's a free investment to clear your mind of what you think homelessness is or is not, and what a shelter is or is not, and start really looking into what it really is and asking the right questions as opposed to the beliefs you may have held incorrectly for years and years and years.
I really appreciate it. I implore our audience to do what you said, right, and really take a look at that. As you mentioned, breaking ground on this new project, starting early next year. What does the future, outside of that exciting development? What does the future look like for your community, out there in Omaha, and for your organization as well? If you look to the future.
I'm it's interesting because I'm very optimistic, but I'm pessimistic at the same time. When you see something like SNAP benefits being cut, that I mean, let's call it what it is. We've got family and children, and I'll just speak for myself here. I don't care. I don't care what SNAP money is or is
Yeah.
not going to. If it's going to food, if it's going to feed kids and families, like, you know, I don't eat the healthiest, but at least I get food to sustain me, to get me ready for work in the morning. My kids get
Yeah.
food to get them ready for school in the morning. We don't have to go a day and wonder if we can even just physically get through the day because we don't have food in our system. It just blows my mind that this has even become a possibility. So when we constantly are seeing some of those things, and it's justified by BS, quite frankly, that's where I get pessimistic. I get optimistic because, again, maybe as a result of a punitive measure we got here, but as a result of being able to have a conversation, we are having very fruitful conversations with our city, with the philanthropy in our city, about what does this really look like? And one thing that I've been stressing in these conversations is this isn't just an investment in the shelter system. This is an infrastructure investment. This is real behavioral health options, facilities, clinicians. This is more addiction recovery. This is low income housing.
Yeah.
And I don't care if it's private low income people, if it's nonprofit, I don't care. Just expand the inventory so people have a place to go in a sustainable fashion. And I think we're actually, for the first time, at least locally, looking at that and talking in terms of numbers that maybe at first presented a pretty big sticker shock. But again, when we reframe it as this is a much better investment than what we're currently doing, those conversations make me optimistic.
I love it. How can our audience get tapped into what you're doing at the Siemens Center?
Well, first, I'd like to say, wherever your audience is, look in your own corner, look in
Mm,
your own backyard. I mean, this is not an Omaha specific issue.
of
This is
course.
everywhere in our country. And find ways that you can support, that you can get involved. When you actually go to a shelter and volunteer at a shelter and you open yourself up to having conversation with people, you will have I guarantee you will have a whole different perspective on who these individuals are. When I first started working in this area, I had the same stereotypes. I had
Of
the
course.
same thoughts. And it did not take long to realize by far the majority of people at a low barrier shelter were just incredible people. I remember I was working at Siena Francis, the low barrier shelter, during COVID, and someone needed some allergy medicine. And we got him the allergy medicine, and he started bawling. He was crying because it's the first time anyone had actually given him anything. I mean, we're just talking allergy medicine. We're just talking about something that anyone should be able to have just for their own health. So I would say to your audience, look in your own backyards, figure out what shelters, educate yourself as to there are some communities that only have a low barrier shelter. What can
Yeah.
you do to really work in your community to get a high barrier shelter? We need a menu of options. We don't just need one place.
A
And
whole
get
puzzle.
involved in that way. If you're wondering what we're doing here locally at Stevens Center, I really invite you to visit our Facebook page. And again, it's STEPHEN. Stephen O. Some people are like, I tried the V, I can't find it.
The best way
It's
to
the
spell it.
it, that's right. It's Stevens Center. Certainly stevencenter.org. We've got a lot of new traffic to our Facebook and Instagram pages. Making investment in kind of our communications through those. And certainly don't hesitate to drop an email, drop a note, and just say, how can I get involved? Certainly, we will always take any donations that someone feels compelled to give. We're incredible stewards of those, and incredibly thankful. And it really does go directly to clients. And a lot of that is because we've made a commitment to our own team, to our own staff. So many times in nonprofits, you've got direct client service providers that are almost client eligible themselves because of the
Yeah, of
salary, the wage that they're making. We make a real investment in our team so they don't have to, so we can at least minimize that stressful impact that the bills, everything else.
course.
The best investment we can make in our clients is an investment in our team.
Chris, thank you so much for coming on and sharing more about the impact that you're making out there in Omaha and the overall collaboration that's going into it as well, and for coming on the show today.
Thanks for having me. Really appreciate it. And we're here to talk more whenever there's a conversation that needs to be had.
Incredible.